But now we'll be heading to the Ashanti region. We have a briefing coming up on COVID-19 to be addressed by the CEO of the Komfo Anokye Teaching Hospital, Dr. Oheneba Owusu-Danso, and of course the Regional Director, Health Director Emmanuel Tinkran, as well as the Director of the Kumasi Center for Collaborative Research.
389 are from contact, are follow-up. Out of these 389, 220 there. Almost 14 days mandatory followed up. No, positive out of the 220. Inti your sign war contacts now ye follow them up. Saying ye war about 150 contacts ye follow them up. And she shy ye to her say ye de kunyare no. Efa a sentimental muhan. Apart from said the royable lockdown, and ye na ye kasa say hand washing, use of sanitizer, social distancing, ni na no ye sign aye and ye may be a ye pesi adi tumo nim said ebe ya obeti ase. Hano obia obenya ya renu bibia no ye free area no high risk area. Inti ye beko ho na ye share about 1 kilometer radius enipa omo ho ni na no. You be mass screening na maomo. Mass screening no enye se bia ye be force umum na emom ye be hye unkran said be ya you subject yourself to the testing. Ana dia to so obi a oye contact bia no so no ye be hwehwe no na no so no ya test contacts no so. Na fi omo so ye follow them up. So whilst we are following them up, we will also take the opportunity and do the testing. Ana you know anmo so omu tu kwan a omo aba sentimental mu ha no so no. Almost 14 days into a moon, Omina, so you show my trap quine. You who am I a normal cassa. Now, here see a better testimony, almost no, ye testimony. And now your hospitals no so ye be a up to her. Ubia or bebia, ye better show more, ye be who say, or signs and symptoms, be and now say, on one cassa person obey a testing, no, almost no, a quine da ho. And so, ye sense she ni na ediama. Ye best friend say. And she shall not buy no dia to hono. Or person the boy in a ho buying. Inti ye war or how mudie. Now so yet me dear trumuka crabby pa. Ye bet me aqua areno. Inti their best friend say, ye na moma yanka and humumu. Na yan queareno. Na meaning say a quina ye namusono. I a president and cassa dear nim said or near cassa said the oshay in crino. Say yes, sir. Ye beti mi akunyare no na enche bia ye nyina ye nya efa ahudi na ye nyuma ye no so yetimi akwakoye na enum se erade nso ebeboa ye ntimu ye nyina koso mompaye na enhihye na ye de ato ho no nso no ye nyina ye nkosu ni so na de ye kɔ no de ye nim se we are on the right track nti de be bia no enche bia no behu se yetimi aso yare na no edama se erade nhra mu nyina. Okay, Prof.
Thank you.
Of course, that is Dr. Tinkran, Emmanuel Tinkran, the Ashanti Regional Director for Health, giving us some updates. We have 389 contacts have been followed. 58 are from Joaso. 2 contacts tested positive. 220 completed 14 days mandatory isolation or quarantine. And of course, the Ashanti Regional Directorate is following up on some of these cases. Ghanaian woman and her husband returned recently from France have also tested positive, and the Ministry of Health has released 400,000 people to help in contact tracing, to manage the contact. And so that's a bit of a wrap from what we just heard. Ohemen Teria is there for us, and on Joy News today we'll bring you details of that. That will be it for Joy News Next right about now. Stay with us. Joy News Interactive is up next. We'll take your views and your comments on all our social media platforms. My name is Ernest Mino. Thanks very much for your company. Thanks for staying with us here on Joy News. We're taking you back to Kumasi, where the CEO for the Komfo Anokye Teaching Hospital, Dr. Oheneba Danso, is addressing the media on COVID-19. Let's head back there now for the latest.
For 2
intensive care management. That is to do with monitors and ventilators and all the various gadgets that you need to manage people who have difficulty in breathing. So that's the setup that we have in Komfo-Anokye. In fact, until yesterday, we had one patient in there who have been managed by us since the 20th of March. And as you were told last week, this patient has been doing very well. And in fact, last week, Monday, a week today, we repeated her test. Because of her very good clinical outlook, the intention was to prepare her for discharge. When we tested on Monday, she tested positive. So we decided that it was better to still keep her in. We repeated the test last week, Friday, and the test came out to be negative. To be doubly sure, we took another sample for Saturday, and that has also recorded negative results. In fact, for this patient, the major reason for her admission to Komfo-Anokye was because of her own comorbidities. She had pre-existing conditions which made her a very high-risk patient, having contracted the COVID-19 infection. So she's been mobilized home, testing negative, very well looking. But prior to that, because of our clinical requirements, I sent a team together with the regional monitoring team to the home to look at the home setting to see how best she will have a very well isolation setup, and that has been done. Every member of the household has been very well educated in terms of the protocols for having her back at home, even though she has tested negative. She is going to remain in isolation for the next week or two, and our team will be visiting her as she continues to take her fluids and other related vitamins and medications. But for now, we think that she poses no or not much risk in the environment that she finds herself. I speak at the weekend, we tested 3 more people. They all came out to be negative. And currently we have 2 for whom samples are being sent to the KCCR for testing. As we have all come to know, I think the key thing for us has been the care for the frontline workers, the protection. I am pleased to indicate that to date, Komfo-Anokye has not really suffered in terms of real shortages for the personal protective equipment. I think we could have more, because as we have always indicated, this is a pandemic. Probably we have not hit the peak yet. We don't know how far we are going to be stretched. So the call for more PPEs is in order, even though we have quite a good quantity in stock now. We have also designed a protocol for the use of the PPEs, because what we realized along the line was that there was some kind of misuse of PPEs, and especially in preparation for a more bigger exposition of the condition, we have to make a very judicious use of the PPEs. So we have actually designed a protocol which has been disseminated in the hospital as to who wears what and at what time, just to make sure that we utilize the PPEs in accordance to the protocol. And I'm sure that for you from the media, we all listened to the presidential broadcast last night. Another major concern has now assuaged the difficulties and the misunderstandings in the health sector, more especially among the health staff. I'm saying health staff because, as has been clearly redefined, when we say frontline workers, it's about everybody working in the health sector today. And I mean everybody. My understanding is that even the private sector is covered. Because the point is that for a pandemic, any patient can appear anywhere at any given point in time. We want to assure and reassure and to embolden our staff just so that they will hold themselves in readiness to treat our patients. And the presidential package that came, as you heard, covered all health staff who work within the health sector of Ghana. I'm sure the details you know. In addition to this, is going to be that core front line. In fact, I have said in conference that all of us are frontline staff. But the fact that we come to work, and for somebody's work, he has to wear a headgear, head cover, nose mask, overall, a special boot, distinguish or differentiates the kind of work and exposure that we are all coming into contact with the condition. So those are the kind of differentiation that you have over there. I must say that we are very, very grateful, especially for those of us managers at the various facilities, because the presidential offer or package, for me, will go a very long way to actually assure our staff. Not necessarily because they want to risk. I have always said that these packages come to motivate us and to get us very well refreshed in terms of our commitment to the work. But more importantly, as I have always indicated, is our personal protection. Because if you even fall sick and you get all the money in this world, I don't think that is exactly what we are looking for. So the personal protection for me is primary, ahead of all the motivational packages that the president has announced. And also in addition, that was announced by the president, is the insurance package that, assuming somebody got sick, the level of sickness, or may God forbid, if any mortality happened to any health staff, all those insurance packages have been signed. In conclusion, I always want to reiterate the do's and don'ts as we have all come to learn. And I've always implored you, the media, to be our medium of communicating this, not just for your formal press engagements, but I've said that you all are in communities, you are in homes, wherever you find yourself. Because I think when it comes to this education, probably those of you gathered here are better educated more than anybody else, because we've said this over and over again. And please, don't just take this just for your news lines. Be advocates wherever you find yourself. And if I may repeat, no handshakes. Make sure that you wash your hands thoroughly under running water. Use sanitizers when you have them. But we have said, use either, not both at the same time. Sometimes it's just an overuse of sanitizers. We said that washing your hand under the running water is primary. Occasionally, you may use the hand sanitizer, especially if you're not working in a hospital setting. And then it's to do with the respiratory hygiene. Cover your nose and your mouth when you are sneezing or you are coughing, just so that you don't actually discharge droplets into the air, into the atmosphere, and especially to people who are nearby you and at homes. We have given you the lines of risk individuals, as we did last time. The aged, especially, don't go near the aged and cough onto them, because they are high risk. People who have pre-existing conditions, comorbidities, hypertension, diabetes, cancers, and all the related pre-existing conditions, that actually reduces the immune status of these individuals. And like I said, once you cough into some of these disposables, you discharge them into your water closets or immediately into a dustbin. And please, social or physical distancing. I can see that today you are better arranged, and that is good. It means that you are all learning through the exposure that we are all getting. And probably last but not the least, it's our own nutrition status. When we talk about immune status, it's all about also what you eat when and how. eat those things that will actually help to build up your immune status. As I indicated the last time, the vegetables and the fruits more especially. I think with these few words, I want to thank you for your attention, and we'll take some questions subsequently. Thank you very much. Okay. You me down say enuanuma atwetwe for amahiem hanum anopay enimu hia hanum a kakra rinya da ata kan na meso meka kakra atoa so say yade ba Ghana hai ye national figure aban de mu na edamanim meka titu afa konfanote ho konfanote asipiti ebisi ene anopay enipa omaba na eya dwen se omo sa yade bi no eye oha aduenu nso a omina ya test omo ya test omina no emu miansa ena lab eche se omo ye positive omo nya sa yade ni bi se de yedi kaisi acheche mu achenu sa nipa miansa ne baaye no mienu efri mu no omo nyina sebe na omo wo yade ahodo bebre o ho a tama ebedu konfajan chi no omo na emodi de otoso mienu kwampo de sere mu amunim no e baaye no we need don hwe bebre ofri mu kra ansana ne lab report no kwampo no e ba beto edi na we nipa ho a oba conference si a ya nhihye ahodo a sisi e we de em se ya boabo an ho a che se covid-19 no se bi ba akwan kro be fa so de ahwe saa yare fo no efizo buduru emergency ho a ya si tent mienu a leading kan no so ba na yehwe wa ni hu se yade no empo e che se ebia ebeye bia ho ne do beko ebi di anu asem etie won sem nyina na di oboni be se nche hu se we high risk patient and say we are highly suspected na ye do akọ holding area ho me se sem nyamra ya mra na me holding area fofo na ya no ya ho kama so ba ho na ye do obi abeto na ya tiku sample near the lab ewo KCC a ekopemra report no ba na chese ampa yade ni bia ansa na yuafi ho edi wakọ bai bia ye yesi ho no ma obia o yade a eye the body be say highly infectious and as say safe isolation center yate atene ho no ho na yesiesie as say ye wo empa be aduenunum ewo ho empa aduenunum ewo ho no bi no die ya yin say intensive care ventilator if dia hodo nyina e ho ase obi ba na se be ne home nsiso ana se ohia se afide be bua no mo otimi je home a ibitimi ahwe no e wo ho no samre ya meka sei besi nura na nka ye ba ko wo ho no sama kwa ne wo ho no sisi ne ho ato ne yie pa if se na otwe ne se ne ye cheke ye no esanta ne ho ye nti ye cheke na ne results ba na ye positive na emum na anu fiada ye sa ye biem ye negative memenda so ye sa ye biem ye sa ye negative prof lab honom ye ni na ne ho din kama a di din ka no yama apomdinfo akohwe ba bi otie ekwan kra se odufi a omudima man dan ono kwa betene mu ene ya kyekye ifie ho nyina obi otie obi a ekwan a ombefa so ene san nipa na atena a enkoba se ase obi ayi na nye fi no so na emom ehu a ewo ho nti ɛsɛ kyerɛkyerɛ ɔmo no ma ɛsɛ ɔmo yɛ wei nipa ho a apɔmudinfoɔ no bɛsa akɔ hɔ mmira no akɔ akɔhwɛ sɛdeɛ ne ho si teɛ a bɛɛ na ɔtwe baako na mmienu di anim deɛ ɛnya adeɛ a ɔbɛpia akɔ baabiara ɔbɛwɔ fie ɛwɔ duboni bɛsɛ the comfort of ɔno ani fie ameahwɛ no deɛ mɛka asɔso biem ɛyɛ ɛnura yɛma mpani president Akufo-Addo nsɛm a ɔde tu ɔman nyinaa anim no ɛm sɛ ɛyɛ ahɔho a ɛma ne gye ɛsan sɛ mo ansɛnkyerɛfoɔ ankutahodoɔ a ɛne mo di gye di nkan no mo busabusa nsɛm bebrebe ɛnam apɔmudinfoɔ nsɛm a na ebi a mo ateteɛ afa ɔmo yɛ die mu nti sisi a mekasa yi adeɛ titiri ohia yɛ paa ɛyɛ personal protective equipment na yɛka ho asɛm no ebi sɛ saa yadeɛ aba yi yɛn nyinaa anim atɔyɛntum ato ewiase amansan nyinaa ɛnkanka ne ama bi te sɛ America, Italy, Spain, China ɛsɛ UK kura ba bɛka ho nhwɛ nipa a efiri mu de bia na ehu nti yɛn nso so aha yɛhia yɛ titiriw ɛyɛ ɛko yɛ si yɛ anim yɛ sogyafo yɛ dɔm kɔ yɛ apɔmudinfoɔ ɔmo hwɛ apɔmudin so ɔmo yɛ sogyafo a ɛno ɔmo yɛ dɔm di anim a yɛ ko saa ɛko yi nti kwan koro bɛfa so a yɛbɛbɔ ɔmo ho ban sɛbɛ yɛ a yɛn a yɛhwɛ ayarefo apɔmudinfo yi yadeɛ bi nkɔkan yɛn ɛnam adwuma a yɛyɛ nti ɔman yɛ atu hanamɔn president atu hanamɔn ɛna ɔde figures ni nyinaa to dwa personal protective equipment a yɛ nyinaa yɛhwɛ anim na ɔtwe baako na ɔtwe mmienu a ɛdi anim ɛnipa ho a yɛakyɛ bi ama kɔmfɔno to so abɛso yɛ so because saa personal protective equipment yi yɛwɔ bi wɔ hɔ nom a yɛde yɛ adwuma na tam biara sɛ dɛm sika no ɛwɔ sɛ yɛsrɛ ɛsɛ nyɛ bi ka ho ɛfiri sɛ hwɛ amaaman a ɔmo adi anim mu ɛnya yadeɛ no kɛseɛ no a ebia na yɛyɛ deɛ no yɛnya no ne kɛseɛ mu nyame mpa ngu nti ɔsɛ yɛboa yɛn ho sɛ kɔba saa mpo a akodeɛ a sɛ yɛde kɔn no apɔmudinfoɔ yɛbɛnya wei nyinaa na yɛde ahwɛ ayarefoɔ a ɔmo ɛbɛba no ɛno pa ho a ɛm sɛ president ama motivation packages for yɛn a yɛyɛ adwuma wɔ ayasabea na health sector nyinaa sɛ mo a mote emoluments tax exemptions a ɔde maaeɛ ɛno pa ho a yɛasa yɛ president asa yɛ insurance a insurance no sɛ obi mpo sɛ wɔn a wɔhwɛ apɔmudim soɔ anaasɛ yɛhwɛ ayarefoɔ sɛ obi kɔ yare a na mpɛmpɛnsoɔ a yadeɛ no ɛde mbɛduro no ɛbɛkyerɛ insurance no de obɛnya firi mu mpo nyame mpa ngu sɛ ba sɛ obi kɔ firi mu nso a ɛno so sika da hɔ ɛwɔ insurance no mu a saa nipa no sɛbe ne nkurɔfoɔ nsa ɛbɛka na bɛde mekasa yɛde ba awie no a mesrɛ mu sɛ nsɛnkanefoɔ mɔmɔ wɔdeɛ na montɔnkɔ so dɛwɔ no deɛ mɔmɔ yɛnyae da ɛkɔsi sɛ COVID-19 yɛbɛpam ne ti kɔkoraa ɛfisɛ yadeɛ no ɔyɛ naadaa yadeɛ wohwɛ deɛ sisi ɔman bebrebe so atum sɛ ɛdaada nipa ɛman no bebrebe ɛm sɛ na ɔmo yɛ sɛ bia ɛnto ɔmo da na buroni bɛfɛ sɛ complacency ɛyɛ adeɛ bi a sɛ yɛama yɛni ankɔ ho na sɛ yɛ adwene sɛ yɛ deɛ ɛntumi a yɛanhwɛ ne bɛma agye yɛn nsɛm sɛdeɛ bɛyɛ a deɛ yɛakyerɛkyerɛ yɛn nyinaa sɛ mankyia yɛn nsɛm yɛnhohoro yɛn nsa nsuo a yɛtene yɛmfa anaasɛ nsuo ɛhwie na yɛmfa hohoro yɛn nsa no obiara mfa nyɛ adwuma wɔ sanitizer no wɔyusu yɛwɔ sanitizer no yɛyusu a mmɛnyusu no ne kwan so cause ɛyɛ sɛ yɛyɛ amena akɔ bro so wɔhoro nsa wɔhoro nsa nsuo ni hɔ na sɛ bɛyusu sanitizer no wɔyusu sanitizer sɛ wɔnwansi anaasɛ wɔbɔ
And apologies, we have a freeze there from the feed in Kumasi. We'll return to it shortly once we rectify that. But of course, that is the CEO of the Komfo Teaching Hospital. Let's head back to Kumasi now. All right, so Dr. Owusu Danso, or Hannibal Owusu Danso, has been speaking about the cases they've been handling at the Komfo Teaching Hospital. Of course, he did mention that they've had 127 cases tested so far. Until last week, the hospital was managing a case which has now been discharged for home care. She initially tested negative, but tested positive again, and there was a final test that proved that she was negative. This was when she was discharged for home care. Let's return to the field in Kumasi.
Yeah, bravo. Inti bidiman bisi ham damasi. I hope there are no questions. No, so that I can go. I have a meeting. Prof will take you through the laboratory work.